Greetings. My name is Letitia Hensley, and I'm the Charlotte-Mecklenburg Schools Director of Family and Community Engagement. We are excited that you are joining us today and know you will gain great insight from this session. At the conclusion of today's session, please provide feedback so that we can continue to support you with amazing sessions that will be provided throughout the year. Now, without further ado, we'll turn it over to our presenters.
Good afternoon, CMS families. Welcome to today's Family Academy Lunch and Learn session. We are so excited to bring Stay Healthy at School virtual clinics and telemedicine with Atrium Health to you today. We are sharing this unique resource. We are sharing this unique resource regarding our virtual care clinics. Before I introduce our guests, just a few reminders that we'll be covering today. We do have translation services available for you. In the top right-hand corner of your screen, you should see the captions button. When you click on captions, a drop-down will appear and show live captions will be available. From there, you'll select your desired language and captions will appear. So once again, in the top right-hand corner, please select captions, show live captions, and please select the language of your preferred language in the drop-down. English is also available as needed. Additionally, we are excited to engage with you today. Please share any questions, any thoughts within the Q&A. Next to the captions button, you'll see Q&A. When you select that button, you'll see the text box appear. We will be monitoring the Q&A and answering real time, but also providing answers for more specific questions during our question and answer time at the end of today's session. We would like you to engage with us and react. If there's any new learning, any ahas, any wows or wonderings, please feel free to drop a reaction with us so that we can see how this information is supporting you and your family at home. Lastly, I do want to also share that these sessions are for you. We are excited to continue to support our families through CMS Family Academy, and we want to hear your feedback. At the end of today's session, please share your feedback to be entered into the April feedback raffle giveaway to win a $100 Visa gift card. We are so excited to select and connect with one of our families from one of our April sessions and provide that reward. So please share your feedback so that we can continue to grow and support you as well. And at this time, I am so excited to share and introduce our two special guests. We have Miss Kelly Sapp. She is serving as an executive in residence within the CMS Foundation, and Miss Patsy Fisher, who is a senior manager at Levine Children's Hospital, Atrium Health. And they will be sharing a bit more about the Meaningful Medicine program and background, as well as how the school-based virtual care or telemedicine is supporting of our staff and students. And at this time, I'm going to turn it over to Kelly.
Thank you so much, Molly. Appreciate the opportunity to be here today and excited to share this resource with all the families and community members. Meaningful Medicine is a program that was launched in 2022 with a grant from Bank of America. It includes 6 focus areas and it is in partnership with Atrium Health, Mecklenburg County, and the Charlotte-Mecklenburg Schools. The 6 focus areas are the school-based virtual or telemedicine care, which is what we're going to focus on today. It also includes school-based therapy, workforce development and career pathways, such as internships with Atrium Health for our high school students, and community virtual primary care, social health screening, and suicide prevention training. So just as a little bit of background, the school-based virtual care is in 108 schools, those virtual clinics. We have school-based teletherapy in 30 CMS schools. And then there's 3 programs that Atrium Health offers to our high school students who are interested in health sciences and interested in a healthcare sector career pathway. One is called Patch, the other is a summer internship, and then the final one is called Rise to Success. But today we're going to focus on school-based telemedicine and the clinics within the schools. Now, many of you may have already read a little bit about this, as you may have received the CMS A Year in Review, there is a really nice article that talks about the Meaningful Medicine program. And I would encourage you to read it if you haven't already. It's on the CMS website. Additionally, the school-based virtual care program that we're focused on today is a really innovative virtual initiative. Again, it's in about 108 of the Charlotte-Mecklenburg schools. It provides real-time health and wellness needs to students and staff during school hours on campus. And it's led by Advocate Health and Atrium Levine's Children's Hospital. So now I'd like to turn it over to my colleague, Patsy Fisher, who leads this program, to take you through it.
Thank you, Kelly, and thank you, Molly, for inviting us today, and welcome to all the parents and guardians who have joined the call today. We're excited to share our program with you in hopes that you find it a benefit to your student in the school that your child attends. So just to take you on a little journey of what the school-based virtual care program is and where we originated back in 2017 out here in Cleveland County, where I originate from, we launched the service in one school. So that was pre-COVID, pre-pandemic. And fast forward to 2022, our program grew through multiple counties, and it encompassed Mecklenburg County at that time. And as Kelly mentioned, we've done some more expansion, and we're currently serving 220 schools in 8 North Carolina counties. Next slide, please. All right, so looking at the map, thanks to generous donors such as Bank of America and Led to Family, you can see the listed counties we serve: Cleveland, Lincoln, Kannapolis City Schools, Stanley, Anson, Forsyth, Rutherford, and Mecklenburg. And Mecklenburg is our largest county. So how does school-based virtual care work? So if a student or a staff member within the schools we serve report to the school nurse or designee with an illness after beginning their school day, the school nurse or designee would perform their normal triage or assessment duty, and then they would reach out to you as the parent to obtain consent in order to move forward with a virtual visit. So again, the student would present to the school nurse sick, and if the school nurse deems that the child should be seen by a medical professional, they would reach out to you in order to obtain consent to move forward with ordering a virtual visit from my team here at the Atrium Health Levine Children's. So once we get consent, we reach out to the parent again. We speak to you directly, and then we will dispatch what we call a telepresenter, which is a certified or registered medical assistant professional from Atrium that would come directly to the school. And with technology, we connect not only the Atrium Health provider, but we encourage parents to join via video so they can see and hear the entire assessment as well. We also have interpreter services that are able to be linked in directly to our visits. So the Atrium Health would provide an exam using technology, giving a diagnosis, and then sending over prescriptions to your pharmacy of choice. If the student or staff member is not contagious, they can return to class for their normal day. If they are contagious, of course, they will be dismissed from school, but we would provide a school note for excusing that absence, as well as expediting their return to school from their illness. With permission, we do send notes to the primary care doctor for the student or staff, and if we identify patients who do not have a primary care doctor, we are absolutely delighted to help find a medical home to establish that primary care, as that is such an important need for our communities. Okay, so we are focused on acute, episodic, chronic, non-emergent needs. We can do some point of care testing we'll talk about in just a moment. And again, prescribing those antibiotics or whatever may be needed to the pharmacy of choice. So some common illnesses you'll see here listed: asthma, allergies, colds, coughs, fever, ear pain, flu symptoms, head lice, headache, pink eye, rash, sore throat, stomach ache, and basic urinary tract infections. And that's just a small list. Our exclusionary list is much smaller than the list that we can treat. So as mentioned, we can do some on-site testing. We can swab for strep throat. We can do a rapid flu test as well. And then beyond that, we do need to send some other cultures and PCR testing for COVID and urinalysis studies to our send-out lab. So what does it cost? Our program is recognized 100% covered by Medicaid or Medicare, and other commercial plans based off of your specific insurance plan. We bill as a primary care, so you would be responsible for any copays or deductibles based off billing as a primary care visit. If you are in need of financial assistance, Atrium Health has a robust financial assistance program, and you may have availability to use that service. If you're automatically qualified for that assistance, you would never receive a statement. But if you receive a statement and you feel that you should have the financial assistance, then you can reach out to our team and we're able to help you navigate that. Wow, looking at meaningful medicine at a glance, this slide always intrigues me, and the smiling faces that we see in our pictures. But operationally, 108 sites. Since 2022, we surpassed our goal, completing nearly 11,000 visits and serving over 8,800 students and staff. So kudos to Bank of America and Atrium Health and Charlotte-Mecklenburg Schools to partner to serve our communities. So what happens when you're sick at home and you can't come to school? We have some community sites as well that students, staff, family members, anyone can access these meaningful medicine access points throughout Mecklenburg. So see listed on the screen, we have CPCC Central, Simmons YMCA, McCroy YMCA, the Latin American Coalition, and the Enlivian Housing, just to name a few, out there as access points to healthcare if you're seeking to find care. So I'll pause, and Kelly's going to share a video that kind of walks you through what a student does when they become sick at school.
I received a call from my child's school that she was not feeling well. She was having a sore throat and an ear pain.
We check their vital signs, ask them what's wrong. One of the goals as a school nurse is to keep all of my students in school and healthy.
As a full-time working mom, it is hard to get off work at the last minute notice.
School-based virtual care has the potential to really affect a student's grades and their attendance. A lot of times that student can be seen that day for that problem and not even miss a day of school. The turnaround time for their illness is usually much quicker.
School-based virtual care is to keep kids really where they need to be. And to do that, we need to be able to offer medical services within the schools themselves. And that's what our program allows.
They offered me the opportunity to take part of the virtual care experience. During the virtual experience, the Levine Children's provider was very comforted and caring for my child. That means a lot to me. I saw everything going on in real time, and I knew my child was in great hands. At the end of the virtual visit, we had a diagnosis and we had a treatment plan.
The parents are able to participate just like they would be if they were in an office here. So even though you're separated by many miles, it feels as though you're sitting in an exam room. Families can be involved and there can be minimal disruptions to both the child's and the parent's life.
As a full-time working parent, this is a great opportunity for our community to be able to utilize this resource moving forward.
The school-based virtual care process is very straightforward. It starts with the kid expressing that they don't feel well, usually telling their teacher, who then refers them to the school nurse. The school nurse then does their own independent assessment to determine if they feel our services are needed. They reach out to consent and ask the parents if it's okay for them to use our services, and to also ask if they'd like to be involved in the visit remotely. After that, a telepresenter is deployed to the school. When the provider is ready, they join the virtual visit, and the telepresenter activates the device that is used. This device allows us to see high-resolution images of the eyes, inside the mouth, also inside the ears, and then to also listen to heart and lung sounds. After the visit is completed with the provider, a care plan is established. And if that involves prescribing antibiotics, they can be sent to the pharmacy. If that involves needing to be dismissed from school because they're considered contagious, the big takeaway is that if they're considered not contagious, they can be safely sent back to the classroom with minimal interruption to the child's life and to the parent's life.
Thank you guys for such valuable information. What an incredible resource to support our families and community. We are so excited that this is within so many of our schools and is going to continue to expand and support additional families in the Charlotte-Mecklenburg Schools community. One question that I would love to hear a little bit more information about is, how do the school-based virtual clinics and the partnerships with principals in the front office, and there's also a school nurse, how do those dynamics play out for our students and families?
Thank you for the question. So partnerships are the secret sauce to our program. We know that our students entrust, or their parents entrust their students' care while they're at school. So the partnership with the principal to open their mind to allowing the meaningful access to healthcare within the school walls is one of the most important components. Collaboration with the school nurse, understanding that we are a tool in the toolkit to serve uniquely to help send those students back to class when they're not contagious, or helping get rapid care versus having to wait possibly days to go see a primary care or ending up in the urgent care or emergency department. And then also when the school nurse is not at school, we want our program to continue. So we have other designees staff identified that can help reach out to the parents, speak about what's going on with their child, and help make the decision to do a virtual visit or pick them up from school. So I would say partnership is the secret sauce.
Absolutely. Absolutely. That is amazing. And so great to hear. One additional question that I'm seeing is, how does this work with insurance? Can you share a little bit more about that, Patsy? How would the virtual clinics work for insurance billing?
Absolutely. So dependent upon the participant's insurance, we bill as a primary care visit. So the same as if you would go to your traditional brick and mortar practice for a primary care sick visit. So if it's a Medicaid or Medicare patient, it's 100% covered, and those families will never receive a statement. If it is a commercial insurance, just dependent upon that plan, copays and deductibles would apply. But again, billing as a primary care visit and not billing as an urgent care or any other type of service, even though that we're mobile coming to those facilities, we still bill the same as you would be billed if you went to a traditional practice for a primary care sick visit. If there are any financial needs, we're able to help look to see if financial assistance is available as well.
That's amazing. I remember the reference of the robust support system that is available to our families. So great to hear great information about the different ways that insurance can be supported through this platform. And families, if there's any additional questions that you are having, please feel free to drop them into the Q&A to be addressed while we have these experts in the room today. An additional question that I have some wonderings around is bringing this innovative technology, having a doctor's appointment over an iPad, with the goal of reducing absenteeism and keeping students in school if they're contagious and can be treated. I imagine this also might help where maybe some families can join the call. I know I've done a little three-way on FaceTime in the past, so that way they couldn't leave work. Are there some of those benefits for parents and the students and the parents of those students at the school as well? Can families use this resource?
So speaking to leaving work, we respect and understand that we're all busy. We are all in our rhythm of life. And to get a call, I, as a parent of 4, to say, your student's sick, you need to come pick them up, just disheartens you. And you're like, how am I going to make this work? So you have to try to either leave yourself or coordinate someone to go get your child from school. So in this program, like you mentioned, if non-contagious, our goal is to send them back to class. So, just having a resource available for parents and helping them reduce their absenteeism from work, that can help, help parents get promotions in a sense if they're showing that excellent work history. So they are able to stay in their rhythm of life. If their child's not contagious, they go back to class and they stay at work, maybe missing 10, 15 minutes just to do an intake with us and participate in the visit. So I think it's a great opportunity to have that resource. The last part of the question, I apologize.
Oh, absolutely.
I think.
Can families use this resource as well?
So families can use the resource at our community sites, absolutely. So if you are not feeling well, the same exact technology, the same service is available at our 5 local Mecklenburg community sites.
Thank you so much. And lastly, I'm wondering, how do the school nurses support or work with our Atrium partners when they're in the front office? I know we talked about partnership with the schools and how that turns out. Are the nurses ever the ones doing the virtual platforms, or is this going to be someone else with my student consistently?
So in our program, the model we have set up, we understand that our nurses are busy. Those health rooms are super busy, in addition to the other tasks the school nurses are required to do within the school walls. So we partner with our school nurses and we become a tool in their toolkit to when they do their assessment and deem that the child needs to be seen, we want to take that off their plate. So once they obtain consent from the parent, they reach out to us, and from there, we help coordinate and perform the entire visit so the nurse can go to the next student or go to the next task. But what we know is that the school nurse is a very, very, very important part of our program. They help guide not only the students to the access, but they are really the health entity of the schools, and the principals look to them for their knowledge and guidance of, is this program appropriate in our schools? Would this be a benefit for you and our students and families? So the school nurse, if I could have a magic wand, I would give every school their very own dedicated school nurse. I still think we would support them in our program, though, because they are so busy, and we just want to be a resource to them, the schools, the principal, and our communities.
Absolutely, I agree. That would be the best magic wand to wave, because we know that all schools and all students deserve to have that dedicated healthcare staff available to support them. At this time, I think we have answered all of our questions, ladies. Families, thank you so much for joining us today. I do want to re-highlight that these sessions are for you, and we hope that you are able to share some feedback on today's sessions or feedback for future sessions of what you would like to see. I'll have the link within the Q&A, and all feedback submitted will be entered into our April raffle giveaway, gift card giveaway. Patsy and Kelly, thank you so much for bringing such pertinent and valuable information to the families within our communities. This innovative and advanced approach to healthcare for students truly is so impactful in reducing absenteeism, making sure our students can stay in class and continue to learn and grow in that educational setting. So our partnership with Atrium Health has such benefits to our students and families, and we are very appreciative of all of the work and strategies that have been applied to support the community as well. Families, we hope this has been beneficial to you, and we look forward to our upcoming Lunch and Learns in the future and having our Atrium team back to continue to support us with this new learning and understanding. I hope everyone has a terrific Thursday. Thank you.